The next lesson plan in this unit is lesson plan 2. Again, there's no demonstration sheet, and it's dealing with confused residents and those who are mentally ill. That population can be very, very challenging, but it's also a population that's continuing to grow. In fact, by the year 2050, probably 75 to 80% of our residents will have dementia. Because that's where most of that population is coming from, and those are the ones that are most challenging. So what we'll look at here are terms that you need to be aware of. We'll talk about the central nervous system again, and the parts that make up the central nervous system, and the changes that go on with mental illness or even confusion and dementia. Normal aging changes, the types of confusion, whether it's a short-term confusion, a long-term confusion, whether it's dementia, whether it's actually Alzheimer's disease, differentiate between deliriums and dementia. There is a difference. Characteristics of residents who are confused, causes of confusion, examples of responses to confusion. Sometimes if you're confused, you're afraid. And if you're afraid, you can really strike out at anybody who's even trying to help you. And I think that's one of the messages that you have to get from this lesson plan, is that most of the time when residents are striking out, residents do have behaviors, it's not you they're striking out at. It is the situation. It's the pain that they can't escape another way. We'll look at an appropriate nursing approach, the way to deal with catastrophic reactions, because you will experience some, and then identify types of mental illness. So let's get started.